by HIV. To give us a snapshot of HIV and AIDS in our local community, we are now joined in studio by Dr. Erica Brown. She is with the Harris County Public Health Authority. So in this UN report, it talked about communities and the power that they have to end AIDS, talking about how they know how to implement, they know how to monitor cases. So what role does Harris County Public Health play in awareness and prevention?
Well, first, thank you for having me. Harris County Public Health is the strategist for Harris County. World AIDS Day is a notation of the fact that we should continue to focus on HIV and AIDS. We provide education and outreach to the community. We also provide services and stand in the gap where there are not robust access to services.
So tell us a little bit more about the demographics. Looking at the data, it seems like minorities are usually the ones that are diagnosed with a higher rate of HIV. Can you tell us more about those groups?
Unfortunately, African Americans have the highest rate of new diagnoses in 2022, followed by the Hispanic community. The African American community is 4 times higher than the white community, and then the Hispanic community is 2 times higher.
So why do you think that is? What factors contribute to that?
Lack of access, lack of education around HIV and AIDS, and lack of destigmatization about the conversation around prevention for HIV and AIDS.
Okay, so let's talk more about that lack of access to education. What kind of resources do you offer people to spread awareness?
Harris County Public Health has free testing for HIV and AIDS. We have free anonymous testing. We have mobile testing. A lot of the issues surrounding access to care have a lot to do with, again, access to care. And so we bring care to the most vulnerable populations. Within that, we also provide outreach and education to those vulnerable populations and across the county.
So let's talk about stereotypes. So a lot of people, there's just so many stereotypes surrounding HIV. How do we break through that?
Normalize the conversation. The conversation around HIV and AIDS prevention should be just as common as the conversation around heart disease, diabetes, and how to protect yourself with physical activity and nutrition. Once we do that, and once we work with our providers around the county to make sure that that's part of routine screening, I think we will go a long way.
So how do we have that conversation with those in our lives, like whether it be children, teens, or just maybe somebody that we're sending off to college? As a parent, how does that conversation look like?
Being open enough, being comfortable enough to have conversations around safe sex practices.
Understandable. All right, so we only have a few more seconds left. Where can people go to get more information about testing and to get themselves educated more?
We have a website, hcphtx.org, and then also for testing, you can dial 832-927-7350.
Appreciate your time so much. This is such an important topic.